Okay, so we have some questions to go through today. First of all, I hope everybody had a good 4th of July and had a great celebration. Saw some fireworks um, and moving through always the 4th of July for me is always like, oh my goodness, it's actually summer. And how did it all slip by so quickly? And we seem to be on the downhill of summer. So get out and enjoy the sunshine, I hope. It's very healing for everybody to get some sun and long days. It can be very healing. So let's jump into some questions first, and we'll open it up for questions here. One question that came through is a person that said they were prescribed an estrogen blocking medication to prevent their breast cancer from recurring. Now, patients with breast cancer, ovarian cancer, prostate cancer that are hormonally driven cancers. Typically, the breast cancer has to be estrogen positive to do this, or HER2 positive to do this, but they'll use an estrogen blocker. With prostate cancer patients, on almost all of them, they'll recommend a testosterone blocker. There's pros and cons to those medications. With breast cancer and ovarian cancer and uterine cancer that are estrogen driven, the estrogen blockers do work to block estrogens. They work very well. And what I hear feedback from most women is that they work too well. It can, when you zap all your estrogen out of your body, it makes you feel like a different person. So it has some negatives to a person. If the person is still in a position where they want to have more babies down the road, well, then that becomes a major problem. It could put you into, the different time of life in a quick hurry, and you may never come out of that. So there's positives and negatives to that. The thought process is that because your cancer is estrogen driven, then if we get rid of the estrogen, it's going to stop the cancer. Well, there's some truth to that, but that's not ultimately the cause of the cancer, is the estrogen. And you're not just getting rid of the bad estrogen, you're getting rid of all the estrogen. So you got to weigh out the pros and cons to that. So I'm not saying you shouldn't do that. I can't legally say you shouldn't do that. It may be the best thing for you. But the reason why we give DIM and the other products, the Sanogastrel and the other products that we use for estrogen-driven cancers, is that there's natural ways to help decrease the bad estrogens without getting rid of the good estrogens. And that's what those products do. So I can understand your oncologist wanting to do that, but you got to weigh out the pros and cons of that. Now, I can't tell you to not or to take a drug or not to take a drug. So I can just give you that information, and I recommend that you research that as well. And we have a number of, I put together a number of articles and some videos on that as well. So I recommend that you look at that and research that as well. Anything in supplements that may cause kidney stones? Obviously, a completely different question here. The answer is yes. So there's some things in people's supplements that can actually be the major cause of kidney stones. And this is where a number of months ago, maybe it was longer than that ago, I did a video on checking your supplements for quality. And part of that video was on minerals. And that's what we have to talk about when we talk about kidney stones, how your minerals in your supplements are chelated. So the minerals, as they come out of the soil into a plant, plants bind minerals with a double bond, typically a double bond amino acid, and then we eat the plant. And that's how we're supposed to get our minerals. And though getting minerals from plant sources, you're never going to have issues with kidney stones. Getting minerals made through a company called Albion or a company called Trax, which neither one of those companies sell minerals directly, but then they sell to good quality supplement companies. So all the mineral supplements that we use are either food-based minerals or they're minerals from albumin or Trax, which are double bonded to a glycine, which is an amino acid, which is the same way that you find it in a plant source. So you're not going to have any issues with our supplements with kidney stones, but you can have issues with over-the-counter mineral supplements. Typically, it's the carbonates. So minerals that say calcium carbonate or magnesium carbonate, they are very difficult to break down by your body. If you absorb them, you tend to not break them down, getting them to cells and tissues, and you excrete them through the kidneys, and they are a major cause of kidney stones. So yes, supplements can lead to kidney stones. Do not take calcium carbonate. Calcium carbonate is limestone. Many inexpensive supplement companies will simply wash and clean limestone, capsule it up, it's calcium carbonate, and sell it as a calcium supplement. Do not take those things. They can be leading causes of kidney stones. Other issues with kidney stones are some things in your genetic pathways, in a nutrient called oxalates that normally should be broken down in the gut and excreted through your feces, but people with specific genetic pathway defects on multiple different genes that are in what we call the oxalate pathways can lead to kidney stone issues too. So if you have a lot of oxalate gene defects, you're going to be much more prone to kidney stones. And those people really have to watch the calcium consumption, especially calcium carbonate. But those people would even want to be even more careful about other calcium supplements. Now, we don't recommend high-dose calcium supplements for anybody, even with somebody with bone loss, because the research is showing that it's really not the calcium that you need. You know, it used to be thought that, oh, you have some osteoporosis, you need to increase calcium to 1,500 milligrams of calcium a day. Well, the outcome of that faulty recommendation has been an increase in heart disease and hardening of the arteries, atherosclerosis. So that's not the decision that should be made. It is not a calcium deficiency, besides the fact that you should be getting your calcium through your vegetables. It is an inflammatory process that's going on in the bone. So if a person has bone loss, you do want to increase the green tea extract that helps decrease that IL-6 inflammation at the bone point. So, so the thing that causes kidney stones are oxalates, the defects in your oxalate pathways, and poor source calcium. So those are the things that you'd want to look at. We don't use any of those sources of calcium in our office. So it'd be something that you'd be taking over the counter. Next question, can low ferritin levels cause your hair to fall out? Not that I know of. I don't think that low ferritin would cause your hair to fall out. Typically, when a person has hair loss, you want to look at thyroid levels, not so much ferritin levels. And ferritin and thyroid don't really go together. Though a person with low thyroid can also have anemia, it's not the low ferritin levels that are causing the hair loss, it's the low thyroid levels. So if you're going to get your thyroid checked, the thing that you want to get checked on your thyroid is your, I should just type it in here so you know, is your T3, your T4, and then you're going to get your total T3, total T4, your free T3 and free T4, your TSH, your thyroid antibodies, your TPO antibodies, and your reverse T3. Those are the things that you want to do in a full thyroid panel. So total T3, T4, free T3, T4, TSH, TPO, and reverse T3. If you really want to get a full thyroid panel, lots of times you'll go in and say, can I get my thyroid checked? And they'll simply do a TSH, which is thyroid stimulated hormone, which is almost worthless to say if you have low thyroid issues. But if you have hair falling out and you're not currently doing something that's damaging your hair follicles like chemotherapy, then you want to look and get your thyroid checked. So those are the tests that you want to do. Um, Next question, supplement for somebody who has anemia. So if a person has anemia, low ferritin levels, low red blood cell count, and there's some different other factors with anemia. There's multiple different types of anemia. So understand that. You can have B12 anemia, you can have anemia due to multiple different factors. But we talk about anemia of chronic disease, which we see commonly with cancer patients, because of the cancer is possibly sucking up the person's iron, you could get what's called anemia of chronic disease. And that's a person who, you could say, well, I don't want to take iron because iron can feed the cancer. Well, you're kind of in a catch-22 situation. I have anemia. I'm exhausted all the time because of my anemia, because it's the iron that's needed for the hemoglobin to carry oxygen to the tissues. So you're going to have fatigue and continue to ramp up fatigue with anemia. So you're in that catch-22. I need to take iron. What am I supposed to do? Well, this is where we like to couple iron with artemisinin or the Laetrile, the B17. Because iron, these two things tend to follow iron. So if we're going to give iron to the body because we need to deal with this person's anemia, we also have to know that we might be feeding the cancer a little bit by doing this also. Okay, well, what am I going to do? I have to get rid of my fatigue. My red blood cell count is too low. My doctor wants me to take iron. Well, number one, we do not want to take a poor source of iron. And by that, I mean the ferrous sulfate, which would be typically something that's going to be subscribed to you or prescribed to you, or typically something that you'll get over the counter at Walmart or something is the ferrous sulfate. Really horrible source of iron, very hard to digest, very hard on the gut, constipates people most of the time. You want to take either a plant-based iron, and we've been recommending the farro food as a plant-based iron. The problem is that the straight plant-based irons tend to not boost up the iron levels fast enough. That's what we've been seeing lately. So then we are switching to the Ferrachel, which is a ferrous bisglycinate, which is the double bond glycine on the ferrous compound as you'd get in a plant, but it's that higher milligram dose. So if we have to give iron to help with the anemia, we want to give either artemisinin, which is the Artemisia annua, or the Laetrile, the B17, to go along with it. So we take it at the same time or near the same time within an hour or so after you take the iron, so that it will go along with the iron into the cancer cell if the cancer cell is going to uptake it. So if the cancer cell is going to uptake the iron, we want artemisinin or the Laetrile to go with. And you can alternate between the two of these as a test. You can take artemisinin one day, B17 the next day. That's a good way to do it, if you think of that. So you're taking the artemisinin and the B17, that it's going to tie onto the iron in your system. It's going to be dragged into the cancer cell. That's the goal. And it's going to help kill the cancer cell. So if we're going to bring iron into the cancer cell, we're going to bring something that's going to kill it at the same time. And this won't hurt your normal cells, so this is fine to take. So that's just our theory about that, to try to, if we have to feed the rest of the body iron, if we're going to be feeding the cancer, let's kill it at the same time. That's our plan with that. Okay, so let's open it up for questions. I'm going to unmute everybody, and we got a few minutes for questions. Anything?
Dr. Connors?
Hi, how are you doing, young lady?
So the artemisinin and the B17, they're not going to take the iron that you need.
No.
Correct?
No, not at all.
Okay.
No. So they don't suck onto the iron like they're gonna gobble it up or anything like that. No, no, no. They just happen to be nutrients that follow iron. So the theory is, okay, if we have to give iron, well, let's give these two, so maybe these will help kill the cancer. So
okay, thank you.
Well, we have Donna. Do you have a question?
Yes, I do. I'd like to go back to the kidney stone issue. I just got my blood work done on the 2nd of July, and I got the results back. And my calcium level went from 12.0 to 12.8. My question is, I read all labels, and I make sure that I do not have any additional calcium in any of my supplements or anything else. Could it be, well, I have multiple myeloma, so I know that a lot of that calcium is coming out of my bones. But could it be something that I might be eating also?
No. So historically, your dietary sources of calcium, even if you were taking a whole bunch of calcium supplements, it's not going to raise your blood calcium. So it's not going to raise your blood calcium levels. You're going to, okay, can you hear me still? Typically, the only thing that's going to raise your blood calcium levels is either a parathyroid problem, and parathyroid tumors are not uncommon at all, or bone loss of some sort. So calcium consumption is like calcium tablets, or I'm drinking a whole bunch of milk, or which is not a good source of calcium. People's thoughts with that, it's not due to that. So it's whenever a person's blood calcium levels are higher, you think bone loss somewhere or parathyroid issues.
Okay. Well, yeah, I know that a lot of the calcium problem is from the multiple myeloma.
Yeah.
But I have appraised, the multiple myeloma went from 2.6 to 2.2 within a very short period of time. So
that's great.
That was kind of confusing because my myeloma is going down, which is good, but then the calcium jumped pretty high.
Yeah. So are you doing that every 2 weeks, that calcium level test?
No, I have it done. I had it done in the end of April. So I do it about every 3 months.
Oh, I would bump that up to at least once a month. See if you could just get that calcium level checked on a more regular basis by your doctor. They should do that.
Yeah, that's no problem. I can have it done at any time.
Okay, good.
Thank you.
Uh-huh. Any other questions?
Yes, sir. I have question.
Uh-huh.
Yeah. I went to your office on July, I think 1st and 2nd. But
yes.
Yeah. And I wonder about my picture. You have a chance to look?
Yes, I did. I think one of the girls emailed you back about that question you had.
Yeah.
Yeah, we're not making any changes in your protocol due to that. But we will be when we get your genetics back, which we haven't gotten back yet. So we're still waiting on the labs to come back on that. Takes a few weeks. It depends on how busy they are. We're running about 3-4 weeks or so on the genetics right now. So we'll let you know. The girls, I don't think pretty sure they don't notify the patient, but we'll be notified as soon as they get that back.
Yeah, and also the picture that Miss Michelle take.
Oh yeah, she'll get back to you. I think Michelle I think Ashley was going to reach out to you today or tomorrow on that. So she's going to do a Zoom call with you with that. So she'll go over it with on the computer, similar to this call right here. You'll be able to see your thermography on your computer. So you want to be on a computer when you do that.
And how about the one that she take from her phone? She take one picture from her cell phone.
Okay, yes.
Dr. Connors, this is Michelle on the line.
Yeah.
I can speak to that. Dr. Connors and I haven't had a chance to discuss that yet. It's been pretty crazy in the office the last few days. And so we've been trying to make it through everything from the holiday weekend. So I had been planning on speaking to him about it this week, but we have not gotten to that yet. I will get back to you on that as soon as he and I have a chance to connect.
Oh, okay. I kind of wonder if it's have to
Right.
go for other treatment or just let it be like this.
Given what I had seen from the photo, I would not probably be thinking that any additional treatment is necessary. Everything that you are doing right now is great and is meant to continue going forward. So I don't believe we'd be changing anything. So don't fret about that. Everything you're doing right now is just fine.
I thought you were talking about the thermography.
Yeah, no, that was my
Okay.
mistake. So we'll talk about that this week.
Okay. But I think Ashley was going to get back to you tomorrow about your thermography. So if she hasn't done that already.
Oh, tomography. I did not take at your office though.
Oh, you didn't. Okay.
Yeah, I just have a saliva test.
Oh, okay.
Yeah, and the picture that we talk about, and I wonder why I kind of feel numb on my leg. You know, it barely to walk, and especially the right side, but feel numb.
Does it feel like numb? Like you can't, like if you push on it, you can't feel anything?
Sometimes I can feel, but sometimes I cannot because I did not walk for a while, maybe a week already.
Right. So when you came in here, you weren't walking. And so are you ambulatory yet? Are you able to get up and move around yet?
I can move my arm freely, no problem. But
Okay.
just my leg kind of have problem because I not walk for a while, and
It can be inflammation on those lumbar nerves on that. It's your left side, you said?
yeah, on the right side.
Okay, so it can be inflammation of those lumbar nerves. If it's only on one side in your lower extremities, that's what I would think it's more of a peripheral nerve problem. If it was both sides, then I'd be more concerned with like a spinal fracture, compression fracture. So it's better that it's only on one side. And do you have a lot of inflammation in your tummy?
In my tummy, I just feel numb sometimes.
Okay. Do you have a lot of swelling or anything in your tummy?
No, sir. No,
No fluid buildup or anything like that?
no. Basically, I just use when I use Enema with
Okay. So if that numbness doesn't start to go away, you may want to get some x-rays of your lumbar spine just to make sure.
And how they can fix the problem, sir?
Yeah, that's if number one, if it's because of any compression fracture, that's going to just take some time to heal. So if it's because of just irritation to the nerves, it takes time for those to heal. Are you able to do the foot bath at all?
Yeah, I did twice already.
Okay, so keep doing those. I think that will help a lot too. So try to do those maybe even every other day or so. I think that will be a help too.
Okay.
And the more you can slowly get up and start moving, I think that will help as well. Get some motion in there. Being very careful with weight bearing, but motion in there will help as well.
And how about acupuncture, sir?
Acupuncture would be great. Yes, acupuncture would be a great treatment for that. So that will really help that whole area heal.
You mean on the back and leg?
Yes, yeah, absolutely.
Or anything else that you maybe advise?
Well, the other thing that might help is using a TENS unit. Are you familiar with a TENS unit?
No, sir.
So a TENS unit, we have them here at the office. They're very inexpensive little electric stim units. that just run off batteries, and they're little teeny, like the size of a cell phone, and they're meant to put on areas of pain, numbness, tingling, muscle issues that can really help stimulate endorphin and kephalin production that can help heal.
Oh,
They're like $50, for a TENS unit. So it's really worth it. They were created a number of years ago for people with like compression fractures because of cancer or disc issues that are not going to go away. They're meant to be used 24/7 if you need to. That's why they're made really small, so you can just stick them in your pocket and keep it on all the time. We've had a number of people that have used those with really good success to calm things down and to decrease symptoms. That's something we can look into too. If you want to call the office in the morning, we can send one out to you.
okay. And again, the name, what the name, sir?
TENS, TENS, like the number 10,
Oh,
but it has an N. It's transcutaneous electrical nerve stimulation is what it stands for.
oh. And also I wonder about the dry machine. I use, like I kind of recycle, like I use, at night, and then daytime I use again. That be okay or not?
What is it?
I mean the right machine. I use at night time. Like at night time I use
Yeah, I'm not sure what it is that you're speaking of. If you want to, or your husband wants to email what that is, then we can email back I'm not sure what product that is or what prescription that is.
I get from your office. They call to right.
I think she's saying Rife machine.
Yes.
Yeah, so you're using that every night, right?
Yes, and also I wonder, each program I can repeat again in daytime.
Absolutely. So you can repeat that same program during the daytime, yes.
Or how about the nerve repair, whatever? That one I can repeat too, right?
Yes, you can repeat any of those programs. You can do it. You can't do it too much. So use it over and over again. Absolutely.
Oh, so it's not going to be harm inside, like a dehydrate anything?
Oh no. Use it as much as you want.
Oh, okay. So the frequency going to be the same thing, right?
Yes. So you can run it during the day, at night. You can run that whole program again. Or if you want to run any of the shorter programs, you can certainly run those during the day as well.
Okay. And yeah, also I have a question about food. I hear about the black salt. It's kind of good for cleaning. What is your opinion, sir?
I didn't fully understand that question. What was the thing that you were talking about?
The black salt from Pakistan, or I don't know. The black salt.
Black
salt.
Salt.
Yeah. They said if drink with water, it kind of help cleaning inside. But I'm not sure about it going to harm the kidney or anything or not, since it's kind of salty. Black salt powder.
Is it black salt?
Yeah, black salt powder.
SALT?
Yes, sir.
So is it like from the Hawaiian black salt?
No, from Pakistan or India.
India?
Yeah.
Yeah, I mean, it still will break down to sodium chloride. The benefit it has, the black salt is typically volcanic origin. So it has some binding qualities for chemicals in the gut. So yeah, within reason, there's no problem with that. If a person has high blood pressure issues or a lot of swelling in their legs, then they have to be careful with how much sodium is in there. But if that's not an issue, you can take it, either use it on your food or take, I know people that take half a teaspoon of that in water or something like that. Yes, you could use some of that.
Oh, okay. Okay, thank you, doctor.
Yes.
Yeah. So maybe someone have question.
Yes. Any other questions from anybody? Okay. Well, we'll get this recording up on Facebook. Feel free to ask questions on Facebook and feel free to email us questions, remember. But please, in the subject line, put Zoom call question because, again, we get hundreds of emails on a daily basis and they could easily get lost. And I don't want you to think that we're ignoring you. So thank you guys. Have a great day and we will talk again next week.
Oh, just wait, Pete,
Thank
doctor, just one more question.
Uh-huh.
Yeah, I'm going to take the ozone and with C injection. So
Okay.
how often I should do that?
So what injection is it?
Ozone therapy and
ozone therapy. Where are you going to get those? Where are you going to get that injected? Is that through the bloodstream you're getting ozone?
Yeah, she take the blood out and then mix with ozone.
So typically doing that on a weekly basis.
Okay.
Makes sense. Yeah.
And with C, vitamin C too.
Vitamin C too. Yep. You could do that weekly. You could do it more often than that, but I'd start out weekly before you go into doing it twice a week, just to make sure you're tolerating it. Okay.
Oh, okay. Yeah. Thank you, sir.
Okay. All right, everybody. We will see you next week.
Yes.
you.
Bye-bye.
Thank you.